Good morning, everyone. I'm so excited to kick off this morning of our first ever Family and Community Conference. Welcome to Boston. I know that some of you may be from here or you're near here, and some of you traveled a very long distance to be here. This is definitely a dream of this community, I can say, for a long time. We've gotten people together in various times and places over the years, and always have had a call of asking for a family and community conference. And so this has been many years in the making, and we hope that it's a really powerful weekend for all of you to connect and for all of us to grow together. And so everyone can walk away feeling connected and hopefully inspired, and that we can grow together. So I'm Betsy Pilon. I'm the executive director of Hope for HIE, and I'm an HIE mom. This is Mike and Max and I. Mike, I think, is probably taking the kids over to the room over there. But this is Max, who is bouncing around as well now. And this is our experience was started in 2012. My background, I was 37 weeks pregnant. Max stopped moving. I went in, had an emergency C-section at our local community hospital that I had worked for. My background is in marketing and communication, worked for the health system that we delivered into. So I knew a lot of the people and the systems, and had no idea that HIE could exist, right? Like most of us, until it happens to you. And so he was on phenobarb, which is, a common anti-seizure medication and first line for neonatal seizure prevention or treatment. We were transferred to Henry Ford Hospital in downtown Detroit to start cooling. And at 2012, especially when you look at the historical perspective of cooling, it was really the time that cooling was becoming standard of care. There's a pretty landmark long-term outcome paper that published in May 2012. It was published in the Detroit News the week after we got out of the NICU. And so we had no idea, like most of you, that the NICU had other causes than just being born early. I knew people that had a baby that was in the NICU for observation, or jaundice. So Max's journey, we started and arrived in the NICU, started the cooling process, and as you all know, the wait and see begins. Wait and see till you get to MRI day. Couldn't hold, couldn't touch, couldn't bother the baby during cooling, right? At that time we were told that would be harmful to him. And then we had MRI day, and it's a sentinel event we know in our community, where for neonatal HIE, the prognosis showed moderate damage to the occipital, parietal, and frontal lobes, and then we were really thrown into the wait and see if he's going to have cerebral palsy, wait and see if he's going to do X, Y, and Z. He had no clinical or confirmed clinical or subclinical seizures. But he didn't have a continuous EEG past 24 hours, so we don't know. He was just heavily sedated on phenobarb, because at that time there wasn't the evidence that we have now that was actually pushed by the HIE community of looking at, can we discontinue seizure medications early, a part of the neonatal seizure registry. And we had no mention of HIE until we had great clinical care and we had great family-centered rounds until we didn't and got a shift change. And we had a neonatologist, sorry for the neonatologists in the room, that did rounds away from us, and I could overhear what they were talking about my child. And Mike had gone back to work, and so I was sitting here at the bedside, and I heard the term encephalopathy, and I was like, that seems important. So I had asked the nurse practitioner to come over because the neonatologist was wanting to continue on rounds. And I said, what does that mean? And they said, it just means something happened to the brain, but don't go home and Google it. And I was like, oh, great. So my sister-in-law, who's a pediatric physical therapist, I texted and said, I don't know what this word means. Can you help me? And she said, we'll talk about it later, but yes, I know what you're talking about. And so we left the NICU without any connection to support, feeling isolated and frustrated. I'm sure that many of you can relate to this, and hopefully many of you cannot relate to this moving forward and have a better experience today than we did before. But Mike and I asked when we got to discharge, and I said, do you have any questions? I'm like, yes. Who are the people? Where are the people for this? Where's the organization for this? Where's the support? Where's the education? What did we just go through this life and death situation with our child for the past couple weeks? And like we know, social workers are angels, and they also are very overworked, and there's a high attrition turnover rate in NICUs in particular. And our social worker was like 1 month on the job, and she said, I have no idea what to give you except for this invitation to join Children's Special Health Care, which is the Medicaid supplemental program in Michigan. And I was like, well, why would we need that? And then early intervention services. That was it. That's what we left with. So, of course, I went home and Googled. I don't listen very well sometimes. And found Hope for HIE, the Facebook group that was started by 3 incredible families. And I want to play this. If you haven't seen it, I hope everyone has, but if you haven't, I'm going to play it. Today, 12 years later, this is an example of the joy and the hope that I think exists. And I want to play you a story about Remy. Gets me every time I watch this, which is probably 75 now. Um, so Remy's mom, Kayla, is in our community, and this beautiful commercial that Remy was selected for and highlighted debuted during the Masters recently. So national campaign in the U.S. And what was so very reflective of where we have been and where we are today. And hearing the stories of our families over the past 14 years is this was what families dreamed of 14 years ago. That's happening now. Technology is catching up. We're at a really incredible point of society and need to keep going. There's lots of barriers continuously that we just keep knocking down. And I just think this is like the pinnacle of what is possible when people come together, research, science, community. It's like such a beautiful case study. Let's see. Whoop. Next. There we go. So I mentioned this, but we want to talk about who's in the room today. And these are all the dots. And one of my favorite things is when the dots all come together. And there's going to be dots that come in and out today, families, researchers, physicians, community members that have traveled near and far to get here. And I just want to recognize that we are a global community, and it's so beautiful that we can bring our global community together. We had Lara's beautiful presentation last night and performance coming all the way from Spain, and Mike from Pittsburgh. So lots of diversity of where people are coming from. And something that we have been a global community. We started as a global community and will continue to be a global community. And so I want to talk about who's in the room today. So we're going to do a raise of hands. Parents. Woo woo. Love it. People living with HIE. Raise your hands, cute kids. And adults. Siblings. There might be some. Yep. Yes, Benji. Yes, love it. Yep. Researchers. Woohoo. Grandparents. Yes, love it. Family members. Clinicians. Maybe, yep, I know, dual roles. Friends. Industry. Yay. And students. Yeah, exactly. You're a student too. And Simran. Yep. And I do have to say I'm going to pause real quick and introduce Simran Bansal. So those of you in the community have probably know about our Highlights of Hope book was something that was really special to create. And Simran was the one that did it for our community. So she conducted 65 interviews, and this was before AI transcription. Like, amazing how that's come a long way in just a couple years. And it really has given a powerful voice and tangible piece for families to hold on to and see themselves reflected in stories. And stories were selected so thoughtfully. Simran is one of the most thoughtful people. She was an intern with us in her undergrad. Her senior capstone project was to build the Highlights of Hope book and publish it for our community as such a gift. And so she is in the room today. She is a med student now at Harvard, right? Yes, wonderful. And she is also presenting at the Pediatric Academic Society meeting here today. She's a rock star. She was with Dr. Monica Lemon's lab in Duke. And we're just so lucky to have, again, community members that care so deeply and do so much wonderful things for our community. So I just want to give her a shout out because yeah. And I think it's really special. She met Tina in person, who is one of the featured families, and to see them meet. And Simran and I had never met in person until today either, which is so crazy. So it's really special that we're able to, again, bring people together. I want to talk a little bit about these all-in guidelines. These were developed by the Next Society, which is another patient advocacy organization for another neonatal diagnosis, necrotizing enterocolitis. Please correct me if I'm mispronouncing that, physicians in the room. But they came up with this through actually a PCORI project and really it's to how we facilitate rooms where we have families, physicians, community members. And so just to go over kind of the ground rules for today, we're breaking down the hierarchy. So you'll see on the name tags, we're first names, humans first, roles second. So there's no like credentials on everyone's badges. Sorry to your very hard-earned doctorates, people in the room. But this is everyone is level set here. And so first names only, we're humans first, roles second. Obviously integrating patient families, prioritizing funds to support patient family participation. Thank you, Corey. We got this beautiful convening award and we're able to have a travel fund to bring, I think we funded 20 families to come here, which was absolutely fantastic, which Maggie has and Allison have worked very hard to coordinate all the logistics of that. And all of you worked very hard to get here through that. Intentionally elevating the voices of women, diverse perspectives, and individuals with rare or unique experiences, making it relevant and personal, investing in building relationships. This is a catalyst meeting. This is like a start. I mean, everything feels like a start, but you'll see the balls rolling as we go through this morning. Support and include families, demonstrate the impact, progress, and opportunities, capitalize on the expertise in the room, and remain receptive and responsive to constructive criticism. So just to level set again, what is HIE? I think most everyone knows, but the second leading cause of infant mortality and morbidity globally, primarily full-term infants, but definitely impacts preemies as well. Significant uncertainty in outcomes, even with advanced prognostic tools. The lack of investment in follow-up care and research, although that's changing. Heterogeneous, meaning multiple causes. It's primarily structural, although there is some, as we've seen in the past decade of genetics, there is some genetic overlap and we're learning more about genetic disposition of maybe someone is more at risk and we can identify that risk factor and mitigate that risk factor. And then looking at the perception and bias that exists of like it's difficult to make an impact and getting a lot of shoulder shrugs. Of course, the people that are in the room here that are driving this forward are not the shoulder shruggers, they're the diggers and doers. And HIE, as I have learned anything in 14 years, is the most complicated, in the weeds onion of a diagnosis, as we all know. But that is not going to stop us. So HIE, neonatal HIE, is under the umbrella of neonatal encephalopathy. It's the most common cause. There's others, and they can also co-occur. The HIE funnel, we know that there's a ton of causes in neonatal, and we also talk about pediatric acquired HIE. And then we have HIE, and then we have all the impacts. And this is not an exhaustive list. And HIE, as we heard last night, is like crash landing in Holland when you were expecting to go to Italy. So we're all in Holland together. But we're going to bloom where we're planted, and we all are here to grow through those cracks together. And so I just want to give a brief overview of the organizational history. So just again, level setting, people that may not know, a refresher, I'm going to crash course through this. These are all available afterwards. So all these little tiny details you're welcome to look at later and as I fly through them. But the birth of Hope for HIE began in November 2010. And that's when 3 parents came together, found each other online through a Yahoo group. So we're going to talk about the evolution of social media as well. And they were from all different countries and found each other. And it was the I'm not alone anymore. You get me, I get you. And let's build and connect because we can't feel alone anymore. We know there's so many people out there that are going through this. So there was a newborn brain cooling group, and they started a Hope for HIE group that just celebrated its 15 years this past week. And Catherine Keeley suggested the name Hope for HIE. And this is kind of like through the lens of our development as an HIE baby as well. So we did the assessment of the baby org in 2010 to 2012. Articles of incorporation, they looked at filing in Illinois. People rotate and change. And so 2012 was really focusing on maintaining the Hope for HIE Facebook group and growing that. In 2013, the Articles of Incorporation lapsed. New parents stepped up. There was a group in Chicago that explored, and then we had another group that explored that I was a part of to find a flag in the ground somewhere in the world. It didn't matter where. I promise you, I didn't expect it to be in West Bloomfield, Michigan. And we planted it because it was based on the resources easiest to do so. And in September 2014, we were officially confirmed as a 501c3. And we launched a website in late 2014, so about 12 years ago now. The Growing and the Feeding the organization, first fundraising campaigns, first awareness months, hosted in-person events. I know some of you have attended like the OG, like in-person parent meetups, and we grew out our social media presence. We knew families were connecting online, so let's give them good information where they start and grow. 2019 was really a pivotal year. This is when we had worked with a parent, Gaby Stewart, who is in London, Ontario, and she was in Iowa at the time and connected with a couple of parents in the Prater Willie community that had started what's called Trend Community, which was an early AI algorithmic assessment of de-identified data to look at unmet needs of a community. So we worked with them to analyze our de-identified data in our Facebook groups and identified unmet needs, demographics, and published on that because physicians need charts and bubbles and stats to look at. And knocking on doors the first 5 years was very difficult to get any sort of return phone call or any return email. And I joke now with a lot of people that I reached out to then that we're now working together quite closely now. And people started returning calls. We got involved in the neonatal seizure registry work group. We were asked to join the Newborn Brain Society, which started in 2019. And we launched our medical advisory board. We launched our support packages. Jen Cages, who was on our board at the time, drove that forward. Just so many things happened in 2019. And so 2020 was a year of growth and a year of weird, right? 2020 was when the world really shifted. But it shifted for us in the positive way that it shifted is Zoom became the norm. And so people would take meetings very easily on Zoom. And now we meet regularly on Zoom, and seeing people in 3D is kind of weird, but we get to do it now, which is amazing. And I moved into the full-time executive director role at the end of 2020. And very quickly after, we onboarded a social worker because we know that we need credentialed support staff in order to facilitate high quality comprehensive programs. So 2021, accelerating our growth, and it's been off to the races since then, expanding our reach, developing high quality educational materials with our medical advisory board. In 2022, again, we added staff, added a program manager to our staff, expanded the resources, began a research partnership with Cool Prime, which is now enrolling babies, and we'll finish that enrollment in the fall for mild HIE and cooling, which was driven by the insights from our community that we know that mild families were asking, is this effective? My child missed out on the one intervention that we have. Is that going to help my baby? And the answer is still forthcoming, and we'll get there. And so these insights and this conduit between the educational and medical side of things and the family lived experience is really kind of the role we've been playing the past several years. In particular, research has become such a huge focus. Um, we've added a child life specialist. Y'all met Annie. Expanded the social work role. It was like a tiny little contract role. Now we have Jen, who's got 20 hours a week plus this week for sure. Expanded our peer support mentor program. Allison's been so instrumental in that, and there's many peer support mentors in the room, which is amazing. And have continued to grow out. And we built our clinical trial and research hub because we have now been contacted by many different people that are working on something for HIE or related conditions like epilepsy, and they need patient input in order to develop what matters most for outcomes for our community, the community that they are intended to work with. And that directive has been given by the FDA and other regulatory agencies around the world because the gaps have existed and things fail. And we don't want them to fail because they're very resource intensive. And our community, as we know, needs more. We need prevention, we need intervention, and we need to have more options and better outcomes. In the past 2 years, we've had this organizational leap. We celebrated 10 years as a nonprofit. We added Maggie, our clinical research program manager, our program coordinator, expanded to have on-demand mentorships, hosted our first family perspective dinner at the International Newborn Brain Conference, and have had some different meetups in conjunction with conferences. We began our hustle program in 2020, and shout out to the hustle hosts in the room. And there's 5 hustles happening today, actually, out there, which is wild. And the originator of that in 2020 was David, and this was before COVID. So our intention was not to have a virtual anything, but it was just easy to try to pull off in the first year. And then everything went virtual. And that has been a program that brings people together and is a wonderful community and fundraising event all over the world for people to participate in. And so now we're in this point of sustainable success and growth, and again, driving forward the unmet needs that our families talk about all the time. We don't have long-term follow-up guidelines for HIE, which you all know is a problem. So that makes access to everything more difficult. We need long-term data. So we launched the HIE registry. You're going to hear about that from Danielle Barber and Eric Peoples, who have been super key on that for the past couple of years and a little bit. Expanding the hospital ambassador program. Tina, our OG hospital ambassador with Seattle Children's, is just absolutely amazing in building the local community out in Seattle. And building out, again, these work groups with our research and regulatory partners as we move forward. And then we're investing now in technology because we have some resources and we can be less clunky with what we do to build more efficient systems and processes. So I'm excited to talk about a little bit that we're going to be building out a community engagement platform. We know social media can be a very toxic place. And while that's a great place to start, it's not a great place. Nothing beats in person and meeting people face to face. There's a lot of people obviously that opt out of social media and it's not a good place at all for many. And so we want to build our own portal for that as well. So this is our community today. Beautiful, beautiful people, wonderful families, wonderful collaborators driving things forward for HIE globally. We now connect and support over 15,000 families worldwide. There were 200, 300 families when I joined in 2012. It's just incredible to see this. We have people that are building things in now Kenya and building in Argentina and building in Australia, New Zealand, South Africa, the UK, just everywhere. There's a presence, which is amazing. And like I said, last year and this year is really about scalability and sustainability. So investing in our systems and processes, looking at challenges, always, funding for nonprofits is always fun. We are scaling quickly. And so we want to make sure that we're meeting the needs that are coming at us, but we want to shift from a reactive approach, especially on this research side and advocacy side, to a proactive approach, which is what we're going to be talking about later today with developing and setting a patient-centered research agenda. And so again, a better cohesive experience ahead. We're going to build out what we've dubbed My HIE Journey. We want this to be a really personalized experience where people can sign up for whatever their journey looks like, specific information, opt out of things without having to not be a part of the community, which is how it kind of is right now. Very clunky again and disjointed out on our Facebook platform. And so we're anticipating that launch in late fall 2026. Jacqueline is on board now as our communication coordinator and will be helping to drive that forward this summer with our organization as well. There we go. This slide got a lot of attention at our leadership summit in October. People didn't realize just like the breadth of what we do. So you guys all in your packets have a printout of this. But our 5 areas, our 5 pillars, I call them, support of our organization are awareness, advocacy, education, research, and support. And that really drives forward what we're doing. We started with awareness, education, and support. Obviously, as we've grown, we've added in advocacy and research to that. And our team has grown. So today we have a staff. We have people that are, we have now, I'm not the only employee, let alone the only full-time employee. We have an incredible amount of people. We're onboarding a research associate, a contract research associate to help Maggie with the absolutely immense amount of research work that's going on this next week. We have our hospital ambassadors. We have incredible volunteers, our incredible board of directors, medical advisory board, and our partners in Hope that we collaborate with to ensure the success and sustainability and partnership of advancing research and things that matter to our community. So obviously awareness, when we talk about this, lots of different things. We have our awareness month. It's April, so it's our big coup de grace this month. David has been a staunch advocate to engage our community and give them toolkits of how to engage their local legislators and things like that of building forward. And obviously our Hustle for Hope has been a really great awareness and community building event structure that we've had the past few years. And I just want to talk about a little bit of what this programmatically looks like, taking it from awareness to advocacy and research to change. So this month, the theme is Hold On to Hope, and we are in conjunction with the Newborn Brain Society doing this HIE Hold-a-thon because we know that was a pretty common thread for a lot of people in the neonatal HIE side about how traumatic it is, obviously, not to hold your baby. And so many have been told, you're going to harm your baby if you touch them or get near them or talk to them. And, I don't think anything, the last quote on the bottom, being told that you're not safe for your baby is traumatizing, and that trauma lasts, as we know. It doesn't go away. I don't think ever, the intensity of it might, but it is always going to be there, I think. And so, we have some really passionate partners. Alexa Craig, who's our chair of our medical advisory board, a lot of her research has focused on trauma-informed care in the NICU. She's done a lot of holding during cooling initial work. And so has Ila Shakarapani, And I actually got to meet him in person this morning at a breakfast, which was really great. And he and Alexa are like the two kind of, superstars on the research side moving forward, holding during cooling. And so partnering with them, working with the Family-Centered Care Task Force, which is a NICU collaborative, we rolled out the first ever hold-a-thon. In the NICU, you hear about kangaroo care and kangaroo-a-thons and things that aren't necessarily applicable to HIE. And this is a global effort. And you will see this lovely polar bear here. This comes from Children's in Omaha, Nebraska, which Dr. Eric Peoples, who's here, this is his unit. And he has been sending me polar bear pictures all month. And so it's just a really fun thing that people are getting into it. Families are holding their babies. The conversation and comments are just beautiful of people talking about how that has changed their trajectory of how they feel and connect to their children. And I know that is also a bittersweet thing for those of us that didn't get to hold our babies too. Again, our support programs and services have significantly grown. Social work, child life, medical advisory board, educational Q&As, community resource network that we're part of with the Child Neurology Foundation, our peer programs with our comprehensive peer support, our peer perspective educational series, which is amazing. Definitely recommend Jen knocks on and begs for people to participate. So if you're a parent and there's topics that she's sending out, feel free. It's not intimidating. It's just talking on a Zoom. Would definitely recommend working with her to get involved in those if you haven't already. Our peer support mentor program and in-person meetups and events like today. Loss and bereavement services and support. We know that we have lost families in this room and in the world, and we know that this is an outcome that we want to make sure that we get as much comprehensive support as possible. So we have these services available. We have now a wonderful Kimberly Taylor. I introduced her last night as well, who is our social work intern, our first intern for social work. And she is a lost parent in the HIE community, and she has lots of ideas to build out more support that she's working through, which is absolutely phenomenal. So we want to be here and do what we can, where we can, how we can to support our families across the continuum. And we talk about advocacy, the unmet needs and care and outcomes. I talked a little bit about it before, but obviously the lack of representation for HIE. Why is it taking so long? I get that question a lot. Like, there should be different, and I will tell you, like, there was no representation and no advocacy before Hope for HIE started in 2014. So it's a slog, and we're playing catch up in a lot of ways compared to other disease states and diagnoses. But we're making progress. Obviously, disparities in care, varying resources by country, by region, by city, lots of disparities in care, lack of longitudinal outcome data collection. What happens when kids are 8, 10, 12, 18, 30 growing up? There's now a beautiful new paper about adult experiences with HIE. And we have some adults with HIE that have been engaging with our community recently, which is fantastic. And the gaps that exist between neonatology and pediatric neurology on the neonatal side. And then the bias and exclusion in NICU, especially with QI. So that's been changing. Like, the Hold-a-thon is a QI project, quality improvement. It's, making sure that there's metrics, we can track it. Families can give input to that. And the NICU space was primarily dominated by prematurity focus, and there was a lack of representation in large-scale NICU support and advocacy. Knocked on a lot of doors, said, why isn't there? And a lot of our wonderful advocates that are in the room have done the same. So Bridget's going to talk tomorrow, but she's one that I think is a great case study of getting involved in a family advisory council and making sure that the HIE voice is at the table. And basics like naming and consensus of diagnosis, we go around in circles about this. I send lots of emails, angsty emails to people that Danielle and Eric are on the receiving end of that often. And family access to first language, accessible educational information. And we know that kids grow up, hopefully, and we center the lived experiences of our children that grow up to be adults. Bloom where you're planted, again with the theme. So again, knocked on a lot of doors. I first knocked on obstetricians' doors. Those were definitely not answered. At first, neonatology got some response. Neurology, huge response, because they see these kids long-term. And then there's been this focus, as I mentioned, on neonatal neurology. So there's a Newborn Brain Society that's really bringing people together and accelerating so much work. I was at their breakfast this morning and just reflecting on what has grown since 2019 in the neonatal neurology space. And now loading, this year, we have had more connections with obstetrics and maternal fetal medicine than ever before. There are national and international investments in better monitoring and on preventative efforts and looking at QI on that side of everything, which we have been obviously long awaiting, right? And so our vision as an organization is to decrease the incidence and impact of neonatal and pediatric acquired HIE. And so this is like a hallelujah coming forward that we are making these inroads as we go and grow. On the advocacy side, collaborations and coalition building. We can't do this alone. There's so many wonderful collaborations out there. Again, you're going to hear about the HIE registry, and we have Paul Gross, who's the founder and CEO of the Cerebral Palsy Research Network with us. He's a dad to a child born with hydrocephalus in cerebral palsy and a force in the CP advocacy world to build with so many people, and we've been fortunate to partner for the past couple of years, and then partnering with so many others in the space. Research. Our families have participated in every single landmark research study for HIE since inception, and we have them in our community. Some of you, many of you may be in the room today. The TOBY trials in the UK, US-based NRN trials, the HEAL study, Cool Prime, the STAR study, more coming soon. And the barriers that exist, as I mentioned, like neonatology, rare, neurology, and rare, this was like a revelation, I think, to many people and to me, after trying to dig into this work for many years, that HIE does meet the definition of rare in many parts of the world, and that allows us to access more resources and more. So it's like trying to find the strategic way of where do we make these inroads to elevate things quickly. And yeah, that was, I think, an email to Eric where he's like, is this rare? And I said, as we're doing a grant application, and I said, yes, it is actually. So the FDA has deemed it rare. So we'll take whatever benefit we can to move things forward as we can. And so obviously babies, children, and families hang in the balance between these barriers. And the HIE research ecosystem, We have academic research, industry and bioscience, regulatory oversight, and then in the regulatory, so this has been fascinating. I'll not go on a long tangent about this, but within organizations like the FDA or the EMA, or other country-based regulatory agencies, there are different arms for different applications across academic and industry, and that there's just a lot of disconnect. And so I think one of the roles that we get to play, after we talk about like the different agencies and different pieces in this ecosystem of clinical, international consortia, government and funding agencies, obviously we're driving forward the patient, family centered and driven research from our organization. And hearing all these things, when people now say, regulatory agencies and other funding agencies say, you need to involve patient advocacy first, I have a lot of meetings, and I hear a lot of common barriers. And so what we have as a place at Hope for HIE is to take those, and we hear them from, the family one, you guys are all so amazing we all communicate so freely of what is a struggle, and can elevate those and kind of look at where these exist and take them and take charge to drive solutions. So one of those is the Neonatal Brain Injury Collaborative. This is through the International Neonatal Consortium when we co-founded this, looking at, okay, what are the issues? We keep hearing back from these agencies like, there's no validated biomarker stuff like MRI. Like we do MRI and we do EEG in clinical care, right? Everyone knows this. Everyone knows their child's MRI, and their EEG discussions. But when you go in the research side, to move something through like a new therapeutic that could be transformative for our community, the regulatory side goes, well, it's not, yeah, you use MRI, but it's not validated. Well, what does that mean? And what do we need to get there? So if that's the hang up, we need to make that not be a hang up. So things like that, like very, again, in the weeds. We started a clinical trial and research hub because we want to really build this external and embedded community culture of research. And we know families are looking at any intervention, whether it's experimental, approved in some stage. We're all looking for the best lives for our kids and need to make the best information based on that. So we have built out this research hub for clinical trials, and we have all sorts of different things to build information literacy about health information literacy with that. Touching again on the research registry structure, we got a pilot grant from the Pediatric Epilepsy Research Foundation to do a proof of concept. We know our information as families is so critical. Like this is the gap, right? Like we have patient-reported outcomes. We know what diagnoses our kids are getting. We know what medication we've tried. And to have that in a cohesive way that is not always captured in an electronic medical record is very problematic to look at what these trends and what the issues are. So this pilot project that was started with Daniel Barber, who is going to talk in just a little bit as the principal investigator, and we have a registry group that meets every Monday at 3 p.m. Eastern to move this forward. The proof of concept grant was to look at 2 sites, so it was at Colorado Children's and WashU St. Louis Children's, of a clinically entered data and a caregiver reported data and a link. And so looking at, can we link these together? So if people move, if they disengage with their local people that they originally enrolled in for the electronic medical record, if there's loss and they don't hear about it, we can hear about it, track and get better, more comprehensive data, which we really need to drive forward change further. And so we've been partnering with the CP Research Network, again with Paul and company. They had an infrastructure already set up, and so why recreate the wheel? It's been a really wonderful partnership. I hope Paul will say the same. But, CP is looking at early detection. We know kids who have been diagnosed with CP, there's often a long diagnostic journey that really shouldn't be as long as it is. And so they're doing a lot of early detection work. We're a great community where we know our kids are at risk for CP. So it's a win-win on that. And the Newborn Brain Society has been involved. That's how Eric got roped into this crew. He took on a crazy Herculean task of finding all the registry elements that exist out there and making sense of them, and then working with a group to decide what should be in what element should be included in a registry. And then our research roadmap, and this is something that Maggie is driving forward. Where we are, we're in the idea generation. That's what a lot of today is about. And so we're building collaborations, defining these research priorities, and then formalizing the research agenda, which is our goal for next year. And so I just have to end with this saying sometimes you do make it to Italy. And what was so amazing at the International Newborn Brain Conference this year that we were very fortunate to attend and be invited and funded to attend outside of Hope for HIE's funds was that Danielle presented about the registry, Eric presented, Renee Schallhaus presented about the neonatal seizure registry. Hope for HIE was extremely omnipresent in the meeting, which I think is something that we dreamed of a long time ago as a community, of being in the room, driving forward what matters, having our voices elevated, and meeting people. So one of this picture of Maggie and I is with a physician who's in Rwanda, who is distributing our materials and trying to build out more support for families in her local community as well. And we connected online, and I've been personally funding her her membership for a couple years as something that we're trying to do with Newborn Brain Society. And she got to come to the meeting and we met in person. It was really, really special. So, and biggest welcome I think we've ever had. Like, it was amazing. So, with that, I'm teeing up that the next session is with Danielle Barber and Eric Peoples, and they are, I can do that. Yep. They are both very interesting researchers that my daughter Emily just is fascinated with. Danielle is a neurologist, Eric is a neonatologist, and they both have a HIE mouse lab where they do mouse surgery and study mice with HIE. And so they're going to transition into the state of HIE research, what we know, what we don't, and what comes next. And Danielle is at Children's Colorado. Eric is at Children's of Omaha, Nebraska. I never know which one to say first, but whatever, you know now. And so they are both, again, in it with our community medical advisory board members, and we're thrilled to welcome them up. Thank you.